Ladies and gentlemen, hello and welcome to our live session today on infertility. This week is National Infertility Awareness Week. No matter what race, religion, sexuality or socio-economic status you are in, anyone can be challenged to have a family. We want to remove the stigmas and barriers that stand in the way of building a family. Hence, let us talk about infertility today. In today's live session, we have Dr. Karunakar Markindi, who is a leading consultant in obstetrics and gynecology, super specialized in complex infertility, sexual dysfunction, and recurrent miscarriages. He practices in both UAE and UK. He provides a patient-centric, evidence-based reproductive care for both males and females. In UAE, he currently works for Prime Hospital and Health and Clinics, Bonehole Fertility Center, Conceive Fertility Center, and Kids Heart. And with him, it's me, Dr. Sarina Siabuddin, AVP Provider Relations of Psycho Health. Welcome, Dr. Karunakar, to this live session.
Thank you very much.
Today, as we are talking about infertility, let us start by saying what is infertility to our viewers. Can you please explain what is infertility?
Infertility is primarily we define it as difficulty or inability to bear a child in an expected period of time according to the couple's expected duration in which they want to be pregnant.
Is there any particular duration of time which the couples need to know when you say infertility?
When women are younger or men are younger, within 2 years, 90% of people get pregnant if they have regular sexual activity and they have healthy lifestyle and they have normal anatomy and physiology. Within first year, usually 85% of people do get pregnant. With the women over 35, we expect this time should not be up to 2 years. We call them infertile even if they fail to conceive within 6 to 12 months.
Just 6 to 12 months. Like anybody, majority of the people who would wish to be a parent, their choice will be to conceive normally or naturally. Do you have any advice for people to enhance their chances of having a normal pregnancy or conceive normally?
This brings to our scientific observation that 98% of the children are born without seeing any doctor, which means they have healthy eggs and healthy sperm and they have regular intercourse or regular sexual activity at home, and they are not exposed to the chemical environment or environment that can affect their fertility. Therefore, majority of the conception that's happening all over the world are through natural methods.
Okay.
Therefore, if we can understand their natural mechanisms are intact, with little advice most people can get pregnant. If their natural infrastructure and functions are heavily damaged, then even the technology cannot help. So always worth starting by encouraging them what is the right way of pursuing fertility journey.
Mm-hmm. Okay, so is there any advice where they can enhance their chance of conceiving normally? Like should they go for is age a matter? Should they think of having a child at an earlier age? Or is there anything like, they should try to change with their food habits or anything like that?
Yeah. Some unfortunately are born with difficult system in them, genetic causes of infertility. So they need to take help as soon as possible. Some at the teenage, they lose their fertility potential. Some, they lose their fertility even in their 20s, 30s, 40s. But interestingly, some other couple are heavily fertile even between 40 and 45. So there is no absolute yes or no, you are highly fertile. So we call them fertility assessment. Any couple, their periods are not normal, their sexual activity is not normal, and they experienced other people taking too long time and they are concerned. That is the time they need to find out their fertility status is optimal, suboptimal or heavily damaged.
Okay.
Then accordingly, they can take help, more aggressive help at the very early age, or they can delay their fertility for a later date. It depends on their fertility potential is in the green zone, amber zone, red zone. In order to pursue, how long they can delay or how fast and how aggressively they should pursue. Even if they pursue with aggression, technology might not be able to help if the extent of the damage and their ability to create a baby is heavily damaged already.
Okay. So if like any normal ordinary couple, so would you say that is there any age for a lady or an age for a man where they should conceive, they should try to have their baby before 25, 30? Is there anything like that?
Yes, for male, interestingly, the fertility seemed to last until 60 and 70, because I have given pregnancies to men in this age group with a little bit of assistance. For women, the eggs that are given to by mother, almost 3 million egg bags, they already exposed to the external environment by the time the female child is born.
Okay.
So the longer the exposure to the natural gametes are there, which means if they get 30, there is a 30-year exposure of their gametes to the external environment, which is typically contaminated.
Okay.
So women by 35, the fertility deterioration is extremely fast.
Okay.
Therefore, women by 35 or man by 70, they need to have alarm bells ringing.
Okay.
But in some, unfortunately, even their 20, their fertility is equal to 40, 45-year-old. In some, the fertility at the age of 40 is they're very youthful and they can have any number of children quickly at the age of 40. Depends on their background potentiality, which can be assessed with simple methods.
Okay. Going to infertility, what is there different types of infertility? Is there a classification on that? If it is there, what are the types of infertility?
For simple discussion, if they already had a child and they're struggling to have second child, we call them secondary infertility. Or they never had the first child, we call them primary infertility.
Okay, so that means there is secondary infertility. That means a person who had a normal child naturally, they can also go to an infertile stage later on, and that's called secondary infertility.
And even the technology might not be able to help them at a later stage, because it depends on the cause why they fail to conceive the second child.
Okay. Can man contribute to infertility, or is it only the women?
1/3 of the couple that we get to see have got the biggest responsibilities on the male factor.
So the male is also responsible.
In
So
another 2/3 also, half of that is contributed. It's a mixed factor, we call them.
Okay.
For example, they don't have interest to have intercourse. They don't know when to have intercourse because there is only small window of 2 to 3 days in the whole month. For whatever reason, the male doesn't perform at that time. The fertility is disappeared for that month.
Okay. What are the causes, if both men and women contribute to infertility, what are the causes of infertility that causes infertility in men and women separately?
Typically, if I take 100 couple coming, 1/3 of them are entirely contributing factors from the male. In another 1/3, the entire contributing factor for the infertility is female. In another 1/3 of the couple, there is some problems in the male, some problems in the female.
Okay.
So we have tests for male to understand. There are 10 different departments or structures or the infrastructure in a man that makes a male to become a father. Similarly, there are another 10 departments in a female which independently or together can contribute a female unable to become mother. So we have tests for each hierarchy of the infrastructure within their body with different testing tools and diagnostic technology.
If we speak about common ordinary people, when should a person identify that they have difficulty in conceiving, or when should they seek medical help for getting pregnant?
When a boy is becoming a man and he is unable to compare his performance to colleagues or peers, he knows there is something wrong with him. So I see people at the age of 15, 16 who are unable to have sexual performance or erection. They start beginning to think they may be infertile as well. So the alarming bells can ring at the age of teenage for a man. Or if he is having intercourse and he is not able to have children for a period of time, like he had exposures before, for a period of time without any protections, he's still not having parenthood. He knows even before they actually want to be a father, there is something wrong with me. So unable to release sperm, unable to ejaculate semen, or lack of interest, or lack of success with the attempts will alarm the bells in a man. Similarly for a female, she may be underweight or overweight, her periods may be irregular, or she may be too frequent periods. Anything wrong with the periods, people know their fertility potential is affected. They don't need to wait for a marriage to be told that there is infertility. There is something unusual about female parameters. For example, getting an onset of menses in the right time, having regular periods. If these things are missing, their parents, their sister, their mother, their family members, their community or the media will tell them there is something wrong with their reproductive system. So that has effect, they can start beginning to worry about their fertility.
So that means they should start looking into these factors and
much
they should
earlier
okay.
than waiting 2 years post-marriage starting to work out, because that may be too little too late at that time.
Okay. So let's speak about couples who would wish to conceive. In that couples, like if they have any problem, if they identify that there is any problem with their conception, which specialty of medicine doctors should they take advice from? Where should they seek the medical help from?
The protocol to study infertility and to do the tests and to treat and seek the specialist help is always there, even with the general practitioner. It can be there with the general gynecologist. But if the problem is tertiary level problem, more complex, then we ask them to be handled by experts who have qualifications and experience and track record and equipment, infrastructure, license to deal with complex infertility issue. Otherwise, any doctor can start doing the primary care, secondary care. Tertiary care will be handled by the licensed IVF practitioners. We have plenty in this country, in every country.
Okay. So once if such a couple comes with their problems of infertility, how do you diagnose these people as, like, whether they are infertile or there is some advice that is required for them to have a proper way of conceiving normally? So how is there any what are the tools that help you to diagnose infertility?
Yeah, so I do educate and train a lot of through algorithms. In one single A4 sheet, we'll give a flow chart where if there is a man want to know his fertility potential, he just gives a simple semen analysis after 2 to 3 days of abstinence. If that is okay, then hardly anything else needs to be done. The next thing is the detailed history of that person. Is he performing? Is he performing on time in the window of implantation or window of conception or fertility window? Right? And if there is any problem with the sperm quality or quantity or absence or presence of sperm, then we go to special semen test. An examination will happen. So all this, including ultrasound, can be done one single stopping in almost 10 to 60 minutes. Within an hour, male can be almost completely analyzed. Similarly, female.
Okay, so what kind of tools do you use for females? Like, do they need to go for an ultrasound, for MRI? How do you go with the diagnosis?
So just to give you the complete list, we start with taking full detailed history in a structured way, and then we do a basic examination with a transvaginal ultrasound, if necessary transabdominal ultrasound, then hormone assessment and tests that are related to her general health. She is looking metabolic syndrome, she looks too heavy, too overweight, too underweight. There are other specific tests. Then after ultrasound, if there is any complex problem, she has pain, we do laparoscopy. If she has any abnormal bleeding, we do hysteroscopy. If these tests doesn't give their ability to create baby or there is any problem, we go for laparoscopy, hysteroscopy, MRI, CT scan. These are the very few percentage of people, male or female, needs the CT scan, MRI, such tests. So depending on the initial test evidence, we use these special tests.
So these specialized tests are not required at the beginning. So it starts with history taking and going with the simple test to identify, and then you progress. Like that means not everybody would need MRI or CT or hysteroscopy. So it depends on person to person.
Less than 5% need CT scan and MRI. I would say 10 to 20% require laparoscopy, 10 to 20% require hysteroscopy, which are invasive tests. I would say 70 to 80% of will be able to identify the extent of the problem and the severity of the problem and the nature with ultrasound, good history taking and good blood tests.
Okay. If a couple is being identified as like they have infertility related problems, in UAE, what are the current infertility treatment available? What are the treatments that we do have in UAE today?
If we take as a benchmark as the top 5 fertility centers in Australasia, Europe and USA and Japan, we have almost 90% of the tests and treatments in UAE.
Oh, okay.
Exceptions being, by law, we are not allowed to use gametes, sperm, egg or uterus to harbor a pregnancy outside the human body from one's own.
Okay.
So except that, we have most of them. There are small exceptions, we call them, those instruments are not available here, such as we call them a man who is paralyzed. We can use what we call them electroejaculator, which allows them to produce sperm naturally, but that instrument to my knowledge is not available here. And specialized tests are there for multiple IVF failure, utilize different countries to complete the workup that is needed. But mechanisms are there, but in-house facilities are maybe 10% of the tests that can be done in any best centers in the world are missing, but 90% are here.
Oh, 90% is available. So anybody who seeks for infertility treatment, they can definitely find treatment here because
they can find the tests, and they can find the equipment, they can find the medication, they can find the experts, and they can find similar success rates with the treatments.
Oh, that is something which is good to know. Yeah, Doctor, one of the most common terminologies we hear linked to infertility is IVF or in vitro fertilization. Can you please tell us more about IVF? What is IVF? How is it done?
Yeah. Typically, out of 100 people I see, only 20% of people require IVF. So people can be relaxed to say, no, IVF is not the biggest advice that we ever give. Only 20% of people need IVF. It does very cleverly utilize the natural wastage of female eggs. Normally, a female wastes 20 to 30 eggs every month.
Oh.
So the cleverness of IVF is stopping the natural wastage and extracting them and creating more embryos or more little babies than nature would otherwise create. Nature tends to create only one. It recruits only 1 out of 20 candidates in the embryo because the female body is designed to accommodate 1 baby at a time. Whereas greedy scientists that we are, we use as many eggs that are available, stop them from naturally dying, and make more than 1 embryo typically in each cycle. And verifying its competency and its quality, we put it in a uterus, which is a living room for the baby, when it's ready to harbor. So IVF is about 6 visits, couple come to us, they take some medication to grow the eggs which would normally die.
So you take the eggs and you grow the eggs outside into embryo. How does it happen?
Yeah, so the egg is almost like a little grape with a seed in it. Seed is the egg and the grape is the follicle, we call it. There are about 20-30. We give medicine, all of this follicle to develop over a period of 10 to 12 days with little injections. These injections are nothing but the pure brain chemicals which every woman uses every month to talk to her follicles anyway. So they're all natural.
Okay.
So that is the reassurance I can give. Medications are purely which is already in the human body.
So it is not a risk to take medications that is being prescribed.
99% of the time it is not harmful.
Okay.
So once these little follicles become big, safely, simply through the vagina without any major surgery, we extract them. It takes around 5 to 10 minutes. So eggs are in your hand and then the man gives the sperm. We do almost like an arranged marriage.
Yeah, okay.
You know, put them together and we watch them, how they get along well with each other under a camera system. So watching their interaction.
Okay.
How boy and girl get along for the first 5 days of their honeymoon.
Okay.
So we find the best made for each other embryo, which is called blastocyst, put back in a very 5-minute simple procedure, like almost like taking your swab for a PCR. It's very simple sensation to putting embryos back. Typically it involves 6 visits, 3 or 4 ultrasound scan, 3 or 4 blood tests and a minor sedation.
Okay.
So in 18 days IVF is completed.
Oh, okay. So when you are doing the IVF, do you put 1 embryo or you put more than 1 embryo or like how is it?
We follow the nature, Mother Nature most of the time. I would say 1 in 80 times or 80 out of 88 times, 87 times allows 1 baby to be accommodated in 1 uterus because it allows the baby to be fully grown. So we tend to emulate nature so that twins which has got potential risks to the mother and to the baby getting admitted because of preterm, which are not very pleasant sight for any mother, any parent to see that. So to prevent complications for twin, to give 1 healthy live child is the ultimate goal of IVF or any IVF treatments.
Okay. Is there a failure that can happen with the IVF? If IVF can fail, what can be the reason for the IVF failure?
If for the sake of audience, in a simple term, if I give an analogy like farming, if the seed is weak and the soil is weak, farmer cannot do anything. An IVF doctor cannot do anything if the egg is very badly damaged, lack of quality, lack of quantity. If the sperm is very badly damaged or it's not there, and you mix them and create a baby or make a plant, but the soil is badly damaged. Or it doesn't support. Yes. The living room is uterus and the endometrium is the baby food. If there is no good supporting system in a female body, it could be endometriosis, fibroid, adenomyosis, pelvic pathology, abnormal blood flow, immune dysfunction. Any of this condition, her general health is very bad. All of this cannot support an IVF created embryo. IVF is only to mix the egg and sperm and to see they are getting along well, and with adding genetic testing to find out they are boy or a girl and they have any Down syndrome. So we can identify all this. But
that can be
without the soil being good, this plant has no way to go.
Do you do anything to ensure that the endometrium and the uterus is ready to take this embryo when you do the IVF? Is there anything like that?
It's a common sense, it's fundamental. All the best centers which give 80 to 90% pregnancy rate all over the world, they do A, which is verifying the competency of embryo, but equally paying attention in the beginning itself that the soil, which is the female body, is up to it. And there's just ultrasound, camera test and blood test will give you the competency. If it is a red competency, then there's no point in doing IVF in this country because you cannot transfer the embryo into another woman's uterus. Surrogacy is by law not allowed in the country. So where surrogacy allowed, you don't need to worry about female pelvis. You can rent a womb.
Okay. With your prolonged experience and awareness in infertility, do you think that UAE has a high incidence of infertile people, or are you seeing infertility is increasing in the current generation? Do you have any observations like that?
If you follow the increase in the number of IVF clinics, number of IVF cycles exponentially growing, almost like 24% growth of IVF services in some countries, around 8 to 12% in UK, for example. So obviously there are more clients and there are more service providers. So that is one. There is no question. All industrialist countries or wherever there is an IT revolution, people come to know, yes, I also can fall pregnant by looking at the doctors and technology. So more people are using it, that's why it appears more. On the other hand, poor lifestyle is the biggest reason. Lack of the appropriate information, seeking an appropriate help at an appropriate age is another reason why more people are infertile. Because they think they are menstruating, they are ovulating. A man thinks there is a semen, he thinks there is sperm. And he is having intercourse whenever he wants, he thinks he will fall pregnant. If he miss 2 days out of 30 days, he is not going to succeed. So there is lack of awareness, one of the biggest or commonest reason for me why people are not getting pregnant. And this ignorance is continuing.
Okay. And people being aware that the technology is available, the help is available for them to conceive is making you see more of
absolutely more awareness,
more incidents.
Internet revolution.
Okay. So that is what is making more awareness in people, and more people are seeking help for getting pregnant.
Classic example is fertility preservation. Different people are coming. I want to delay my fertility.
That's my next question. We are saying that age is a factor, and we need to see that before certain age, it is good to conceive. So, what about if a couple decide that they want to postpone their pregnancy? So, what are the measures that is available for them to delay their pregnancy?
Luckily, the technology has revolutionized the safety with which egg and sperm or embryos can be stored for future, even up to 50 years. And that's very much available in UAE. If it is affordable, and if there is a good expertise, it can be availed. So male and female can preserve their fertility when the fertility itself is in the green zone. If you are preserving a poor quality sperm, poor quality egg, you are not going to expect much in return. So it is suitable for those people where they take the right advice with the right people to know they are storing good quality eggs, good quality sperm, good quality embryos to begin with. For them, it's very applicable, and it can be stored up to 5 years by law in the country. In some other countries, it can be stored until you are 55.
Okay. Thanks for your time, doctor. Thanks for giving us information about infertility and the ways, how the people can be aware of this problem, which is, first of all, when you said there is the lack of awareness that is causing to infertility, maybe they can look into all these, and that can help them, and also they can seek medical help whenever required. So with this, we are wrapping up this session of infertility. Fighting infertility is like fighting for a dream. And the causes of infertility can be multiple, it can be complex, and it can vary from couple to couple. However, infertility can be treated, and we believe that together the treatment of infertility will be a positive experience. Thank you for watching us, and thanks for being with us.